Duodenal ulcer by Morgan Garnier and Aleena. What is an ulcer? There are a few different kinds of ulcers, including peptic ulcers, which develop in the stomach or stomach lining, esophageal ulcers that occur in the esophagus, and a duodenal ulcer, which is the type of ulcer we will be focusing on today. So what is a duodenal ulcer? It's an ulcer occurring in the lining of the small intestine in the duodenum, which is just beyond the stomach, the most common cause being H. pylori bacteria. This is our case study. Mr. Smith has been a smoker for the past 20 years, drinks 4 to 5 times a week, and to curb his hangover is a frequent user of ibuprofen to take away his headaches. He noticed lately that after he eats his meals, he feels very full quickly, and if he waits a while to have a meal, he feels a burning sensation in his abdomen and gets nauseous. To prevent this, he takes an antacid, but this usually only helps for short periods of time. The pain has been tolerable for the past month, but has started to become more severe. The pain is also worse at night. The major risk factor for a duodenal ulcer is an alliteration in the balance between the amount of acid and mucus in the duodenum. The main cause of this imbalance is H. pylori, which is the bacteria that weakens the mucus that coats the stomach, and this is how the lining gets damaged, which we will go into more detail about later. Other causes are a history of radiation therapy, anti-inflammatory meds like aspirin or NSAIDs. These medicines sometimes affect the mucus barrier of the duodenum and allow acid to cause an ulcer. And also stress, smoking, drinking, and use of tobacco. There are other causes, but they are rare. For example, the Zollinger-Ellison syndrome. In this rare condition, much more acid than usual is made by the stomach. The duodenum is the first part of the small intestine, and it is also the smallest part of the small intestine. It is C-shaped, has 4 sections, and curves around the head of the pancreas. It receives the digested food from the stomach and absorbs all the nutrients from this food, as well as neutralizes acidic gastric juice by producing alkaline secretions. Another important role is it mixes bile and enzymes. A duodenal ulcer affects the first part of the small intestine by the corrosive action of peptin and H. pylori bacteria, which all takes place on the mucosae in the GI tract. The H. pylori causes inflammation, which essentially breaks down the lining, which is so important to having a healthy small intestine, because when this happens, you form a small hole, which causes lots of irritation and painful symptoms, including the burning sensation. This photo shows exactly where a duodenal ulcer forms. The main symptom is pain, especially in the upper stomach, which occurs mostly before meals or times when your stomach is empty. Usually this pain goes away when you've ingested an antacid or have eaten, although those treatments are usually short-term. Other symptoms include nausea, bloating, and feeling full quickly after eating. Treatment can be through the form of lifestyle choices, medication, and in some cases surgery. Lifestyle choices include avoiding certain foods, monitoring the amount of caffeine and alcohol you drink, and if you smoke, quitting smoking. Medications can sometimes cure a duodenal ulcer, such as antibiotics, antacids, mucosal protective agents, which protect the lining of the stomach, and H2 blockers, which reduce the amount of acid in your stomach. Medication and changing lifestyle choices are the main ways to treat it, but if these treatments don't work first, or if your ulcer has serious medical problems, then surgery may be needed. Usually a duodenal ulcer can be cured and treated with no long-term side effects, but sometimes complications can occur, such as internal hemorrhaging, perforated duodenal ulcer, which can lead to bleeding, severe discomfort or pain, and spread of infection. So how are duodenal ulcers diagnosed? Healthcare providers will look at your past health and give you a physical exam. The following tests are conducted. First, an upper GI series or Brugerium swallow. This test looks at the organs of the top part of your digestive system. It checks your food pipe, the esophagus, stomach, and first part of the small intestine, the duodenum. You will swallow a metallic fluid called barium. Barium coats the organs so that they can be seen on X-ray. The second test is an upper endoscopy or EGD. This test looks at the lining of the esophagus, stomach, and duodenum. It uses a thin lighted tube called an endoscope. The tube has a camera at one end. The tube is put into the mouth and throat, and it goes through esophagus, stomach, and duodenum. By this, we can see the inside of the organ and can also take a small tissue sample, which is called a biopsy. Some lab tests can determine if you have a duodenal ulcer, including blood tests, stool culture, and a urea breath test, which checks the amount of carbon dioxide in your breath when exhaling.